For many years, people called it isichireyare or isikafuayare, the illness for the wealthy. Now, that is certainly not the case, as 1 in every 9 Ghanaians has already been diagnosed with diabetes. That's 11% of the population. Scary figure. But did you know that the cost of insulin injections and daily monitoring can consume as much as half of a family's average disposable income? What about a patient whose family in several cases are unable to afford or even access the basic necessities to fight diabetes? Well, here are some solutions being proposed: prevention, support, and taxation. Now, as we commemorate World Diabetes Day, we're shedding some light on how best families can manage the increasing spate of cases. Kenneth Awachidako put together this report.
Diabetes is a group of metabolic disorders in which there are high blood sugar levels over a prolonged period. Symptoms include unintended weight loss, increased urination, increased thirst, and increased hunger. In Ghana alone, over 8,300 people died of the disease in 2013 and another 5,000 in 2015. The theme for this year's World Diabetes Day, the family and diabetes, has brought to the fore the need to create a support system for those affected by diabetes. According to Deputy Head of Care at Diabetes UK, Douglas 24, a very strong family foundation is an essential step in improving the health of such patients.
Well, because we are not doing we are doing almost nothing, which for me is not an option. So for example, if somebody has type 1 diabetes, how they manage their diabetes is that every time that they are going to eat, for example, they are going to eat fufu, they have to count how much carbohydrate is in the fufu. That's a huge task. And they need support. They need support from the family. Also, some people even think that if you have diabetes, you have to cook for yourself. So there are people who will prepare food for the rest of the family, and then they will have to prepare their own food, which makes the social aspects of eating a bit, non-existent. So it affects people's emotions as well. For me, the theme for this year's Diabetes Week is that we are going to raise awareness of diabetes first. And the reason for that is, if you have a family member who has diabetes, your risk of developing diabetes increases.
According to the International Diabetes Federation, an estimated 382 million people have diabetes worldwide, with projections to 300 million by 2025, with majority of this increase to come from developing countries. While Ghana's Health Ministry has taken certain steps to tackle the disease, the specialist dietitian believes the efforts should be channeled at preventive measures.
First of all, the government has to make some resources available to raise awareness of type 2 diabetes, but also think of some policies to help people live healthier lives. I'll give you an example of what's happening in the UK. At the moment, the government is committing money to putting together a diabetes prevention program. And that program is for people who have been screened and have come out to be at high risk of developing type 2 diabetes. So they give them the necessary dietary and lifestyle advice in order to manage that risk.
Consequences.
All right, and there's a whole lot more to learn, because we're quite honored to have with us the man you just saw speaking so authoritatively on diabetes, Douglas 24. Now, he's a specialist dietitian. He's the deputy head of care at Diabetes UK. And we're lucky that he's chosen to take his holiday in Ghana at the same time that World Diabetes Day is happening. Douglas, we're so happy that you're able to join us.
Pleasure.
Yes, and of course this conversation is under the Sugar Project, which is an initiative here at Joy, which I'm very, very concerned about. And we definitely want all Ghanaians to be as educated as possible about diabetes. Now, Douglas, unlike many other conditions, diabetes affects not just the person diagnosed, yes, but everybody around them.
Absolutely.
But we don't always realize that. So can you first of all talk us through the ways in which family members, friends, work colleagues are affected when there is a person with diabetes amongst them?
First of all, I think this begins with the person with diabetes being open about their diagnosis, and that's very critical. And I'll give you an example. I was having a conversation with a colleague of mine, an old colleague of mine, talking about his type 2 diabetes, how he's struggling with it. And at the end of the conversation, he told me not to tell the wife. So this is somebody who's had diabetes for 2 years, living under the same roof with a wife. So my question to him was, this is a very bright young man. My question to him was, who cooks at home? And then he said the wife. He has a high blood pressure, so I asked him, how much salt does the wife put in the food? He was like, I don't know. And then that started the conversation. You need to inform people around you so that they can support you. So the first one is on the person with diabetes. Once that's done, you can also discuss exactly what specific support you might need. I'll give you an example. Especially those who have type 1, treated with insulin, there is a condition called hypoglycemia, where blood glucose levels unfortunately can drop very low, and it can lead to somebody having a seizure or you being very confused, disorientated. You might need support for somebody to even fetch you a sugary drink so that you can treat that condition. If you haven't been open to explain it to the person, they will not be able to support you. Another example, couples. One of the most underreported complications of diabetes is sexual dysfunction. If you haven't told your spouse and you're having problems, how do they support you? But then by being open and discussing these things, your spouse can help you get the support you need. So for me, it is key, and it's even good that for this year, the theme is around family, because without the support of family, it's very difficult to treat diabetes on your own.
Indeed. Now, you've mentioned a very interesting example there, but what was obvious from what you told me about your friend's reluctance to tell his wife is that there is still some stigma attached to the condition.
Yes.
First of all, in your experience dealing with so many patients, why? What is it that bothers people about informing the world that they have diabetes?
I think it has to do, and I will apologize to the media, it has to do with how the media portrays diabetes. It's as though everybody who has diabetes brought it on themselves, whereas we know that type 1 diabetes has nothing to do with your lifestyle. Of course, type 2 has to do with your lifestyle, but also there's a genetic component to it. So I'll give you an example. You know Steve Redgrave?
Yes.
Who is an Olympian. He was very physical. He's won Olympic medals. He had type 2. You cannot tell me that it was because he wasn't exercising as much. So I think that stigma is the problem. But also here, our culture is a bit different. Have you heard of any MP who has come out to say they have diabetes?
Do you know how hard I tried? You know, as part of the Sugar Project, we wanted to fight this stigma.
Yeah.
And we did some testing with another organization in the previous parliament. We tested over 200 MPs.
Yes.
And found quite a shocking number of them
I'm not surprised.
were diabetic. So they were all referred to the clinic. You know, there's a clinic at Parliament.
Yes.
They were all referred there to go for follow-up appointments. Guess how many went? None.
I wouldn't be surprised
None.
at all.
Zero.
But if you go to the UK, the Prime Minister has diabetes. She's open about it. We have another MP, Tom Watson, who came out last week, or last month actually, to say that he has lost 45 kilos since he's been diagnosed with diabetes. He's been able to put his type 2 diabetes into remission. You know what that means is that if somebody has type 2 diabetes, they can say, first of all, it means I can live a normal life. It is not something to be ashamed of. But also, I can take inspiration from this MP to look after myself and try to manage my condition properly. In the UK, employees are duty bound to let their employers know that they have diabetes. And the reason is that diabetes is captured under the Equality Act.
Okay.
So it is defined as a disability, which means that employers are duty bound to make reasonable adjustments to help their employees. So I'll give you an example of Theresa May. In the Commons, so the floor of Parliament, you're not supposed to eat. But because her diabetes is under the Equality Act, she is able to take snacks in so that when her blood glucose levels are dropping, she can be able to treat it. Why can't we do similar? Open it up. MPs, and I am very sure some MPs do have diabetes. Come out, and that will even
I can
help
assure you they do here.
push for some policies to be in place.
Yeah. There are a few, and I can think of two at the moment, who have agreed. They are public figures, but they have actually spoken on Sugar Project platforms.
Perfect.
They've consulted with me, spoken to me, advised me, and even spoken to other diabetics about managing their condition. And they are not ashamed to have diabetes. One of them is Justice Emil Short.
Okay.
Yes, very well known, and he's been on the Sugar
I'm not surprised
several Sugar Project events, and he keeps very, very healthy.
Yeah.
He's very disciplined with it. Kofi Toto Bikwache is another example. And they don't mind. They are not at all embarrassed by it. And, well, I struggle to find what is embarrassing about that.
It shouldn't be, because as I mentioned, there are risk factors that you cannot modify. So if you have a family history of diabetes, your risk is increased. You can't change your family. Even if you're a man, compared to a woman, your risk
have a higher chance.
Because whereas women genetically put weight around their hips, we men, unfortunately, we don't try, but by nature we put it around our belly. And by putting weight around your belly, you increase your risk of developing type 2 diabetes. It might not be totally down to you. So, in my view, people who have diabetes should not be ashamed. It is for you to come out, tell people that you have diabetes, and don't end there. Tell them exactly what specific support you need. Because, again, diabetes increases your risk of depression. So if you keep it bottled, your risk of having depression and breaking down is very high.
Let's talk about families.
Yeah.
And, of course, that's the theme that this year's World Diabetes Day is circling around. Let's go into some realities and practicalities of what families really need to be aware of when they have a member with diabetes.
So, I like practical examples. So, families do throw parties, because if you have somebody on insulin, they come into your party, you necessarily have to have something carb or carbohydrate for them, just in case they drink a little bit and their blood glucose levels are dropping. If you are aware that they have diabetes, you'll be able to prepare for this. Again, sometimes people might not even be drinking, but if their blood glucose levels are dropping, the symptoms are similar to somebody who is drunk. If you are not aware, you can say, oh, he's had too much to drink. You leave them there. Unfortunately, they can go into a coma. So being aware is critical. But I also think that even discussing with the family, the benefit is not for the person with diabetes alone. But if you know that your family member has diabetes and you're aware that your risk is increased, it gives you some incentive to also take care of your health. One of the things that I normally do is sometimes when I am seeing people in clinic, ask them to bring their spouse or their family member. Sometimes the things that the family member will reveal to you, it gives you more tools to be able to support the person. Because, for example, I had a man who was putting on weight. He was, denying that he's eating too much. It turns out that it is the wife that does the tea for him, and he's not aware of how many sugars the wife puts in. It was only
Wow.
when I brought the wife with them in a consultation that the wife revealed this to me. It gives me, as a clinician, more tools to be able to discuss how they can support themselves properly. So family is key.
So you advise that family members actually accompany
Absolutely.
their members with diabetes
Yeah.
to the hospital, especially if it's a spouse or someone who lives closely with them all the time.
Yeah.
Because extra information can help the doctors.
But also some of the recommendations that the doctor will give you, sometimes you need somebody as the police to check you. It might not be that they beat you into doing it, but just reminding you, do you remember that the doctor said you should not be eating too much of that or too much? It helps.
Yeah.
As a gatekeeper.
Indeed. Now, what would you advise to those who are watching us? They have family members, loved ones, who they know have diabetes, but because of how culturally we treat conditions like this, they may not have considered that it affects them or they have a role to play. What is the first step? What can they do today to become more helpful and useful to that diabetic in their family?
I think just by listening to you, it will be revealing, hopefully, to them. So I thank you for this opportunity. Because what they can do is to go to their spouse or family member and say that, oh, by the way, I didn't know that much about diabetes. Now I know a bit more. What is it that I can do to help you? That will open up the conversation. And then hopefully the person with diabetes will say, okay, do you know that sometimes I get irritable?
Yeah.
And then we say, oh, by the way, that is because my blood sugar levels are dropping. That's why. And then the person can say, whenever you see me irritable, it's not as if that I'm a horrible person, but my diabetes can cause that. And what can you do to help me just understand me? Just that understanding alone will be reassuring to the person with diabetes.
Do you know how glad I am that you brought that up? Because it is a major issue in my personal life, and when my blood sugar is dropping, that is one of the number one symptoms.
Yeah.
I have just very little patience
Absolutely.
for everybody around me, and little things that most people can deal with, I get extremely irritated by them. Yeah. And it's just because my blood sugar is a bit lower than it should be. It's harder to find a smile, when that is happening. But you can't. It's hard to explain it each time. So it's good if you have people around you who already know, so that they can deal with it, right?
Unfortunately, the awareness is not that good, especially here, and that worries me. It worries me because diabetes is not part of the national discourse. That worries me, but hopefully that will improve with the good work that you're doing with the Sugar Project. Hopefully that will bring up more of the information. But I can also say that those people who have family members, they should get more information from the family member that has diabetes. People with diabetes sometimes know a bit more than we clinicians because they live with a condition day in, day out. Whereas we see them for maybe 3 hours the whole year. The rest of about 8,000 hours, they live it with them. So it is about the person with diabetes also being proactive to say, oh, do you want to know more about diabetes? And then they can also point to, there's a lot of information on Diabetes UK's website. And people can learn from there. But also the suggestion that I made, which is that people should go to clinics with their spouses and their family members. You can learn more from there. I think that the best thing that people can do is to be proactive in learning more about diabetes so that they will be able to support the family member with diabetes.
Now, you are a specialist dietitian. That's an important part of this managing diabetes, but in Ghana, our food must pose a particular challenge. Am I right?
Yes. And the reason why I said a categorical yes is that most of our meals are based on carbs, carbohydrates. So fufu, banku, kenke, rice, they are all carbs. When you eat carbohydrates, your body breaks it down to sugar in the blood. So if you have diabetes, you have to be able to manage how much carbohydrates you're eating, because the more carbohydrates you eat, the higher your sugar rise after you've eaten. Of course, other things also come to play. So for people with type 2, we know that if you are obese, losing weight, no matter how you do it, is the best way to do that. So our food sometimes is really high in fat as well. So our traditional way of preparing our soup is that we tip the bottle and make sure that there's enough oil for the onions to swim in it. That's one thing that we can do. So it is not entirely due to our food per se, but how we prepare it and the quantities that we eat. That is our biggest problem.
So there are people who have just watched you explain how our food is just generally not best for diabetes, and they are wondering, okay, what does this mean? If I have diabetes, or if my partner has diabetes, does this mean I must stop giving him fufu?
No.
Okay.
That is another categorical no. It means that, and it's good that you brought fufu. It means that if you are having, normally, the way we eat our fufu is that you have one person with 2 balls of fufu, and it's not small balls.
The twin balls.
Absolutely. Yes. So it might be as simple as saying, okay, I'm going to have 1 ball, and in place of that, I'm going to thicken my soup with some green leafy vegetable, contomere. It makes it thick so that it will fill you up, but you're not eating as much carbs. But you can also eat more of the fish and less of the red meat as well. So for me, I'm a good advocate of eating our own foods, but maybe making a few changes to it. One difficulty again is our love for salt. We know that salt will not affect your blood glucose levels, but it will affect your blood pressure. And the complications of diabetes are influenced by blood pressure, cholesterol, and your glucose levels. So again, how you use your salt. Why not put more peppers in it so that it gives you that taste and less of your salt?
So there are always alternatives, and the best person to give us those would be our dietitian, no doubt. So look, it doesn't mean that you can't enjoy the foods that you've grown up with and have become accustomed to. It just means you have to adjust your portions and and make sure that you're having more greens and fruits and vegetables rather than the carbohydrates that are always the dominant part.
That's
of our
the problem,
meals, right? Now let's talk about testing. Now, I mentioned earlier a shocking statistic that 1 in every 9 Ghanaians has already been diagnosed with diabetes. 11% of us have diabetes. That's what we know. Those are the ones we know of. Okay. There are those who haven't even had the opportunity to test. I want us to talk a bit about that as well.
Okay, so I'll add to your statistics. Globally, the proportion of people who have diabetes that have not been diagnosed is about 30%. Don't worry about that. In Ghana, it's 75%.
You're joking.
I'm telling you, 75%. So what happens is that you've heard many stories of, oh, this guy was healthy, he didn't have any condition, but he dropped dead.
Yes.
Many people have diabetes, and the only way they find out is when they have a heart attack. If you're lucky and you survive, then that's where you get your diagnosis, which is appalling. Yeah. But to come back to your question about testing, I think at the moment, and this is where I'm going to sound a bit political. So a clinician being political,
you're allowed. You're allowed today of all days.
I think the government, whoever the government is, should be proactive. Proactive in having some screening program. What you're doing is great, but to be left to an individual or an organization like Multimedia, I think is unacceptable. Government should be proactive in screening people. In the UK, if you are between the ages of 40 to 74, automatically you get checked every year to see whether you have diabetes and other conditions. What that does is that it picks up people who would not have been diagnosed and you give them the necessary support to be able to manage their condition. You might ask me, why should government take the initiative to do that? Diabetes affects the working population. So economically, it is not viable for government to have nothing to do with it, because you'll be losing your working population. Diabetes is the leading cause of blindness, leading cause of kidney failure, ending people on dialysis. So if the people who are supposed to be working to give you the tax to be able to, implement your policies, you are losing them. It makes no sense. Again, I know that our NHIS was more or less framed around what happens in the UK with this NHS. The NHS started as, let's get people sick and then we treat them. At the moment, they are near bankruptcy because of the number of people who are obese and number of people who are getting type 2 diabetes. So they've realized that no, we should not be waiting for people to get sick and then we treat them. Why not invest into prevention?
Yeah.
And I think that our government can learn from them to also do some prevention work. It might be population-based prevention work, which is that you slap a tax on energy drinks and sugary drinks. It is not the people who are poor who usually will afford these.
Yeah.
And we don't need them in our daily diet. So if you slap a tax on it, government gets some revenue to be able to implement the prevention.
A deterrent, hopefully.
It becomes a deterrent.
Very important point there. And just as I'm getting excited and getting into the conversation, I get told that we've sadly run out of time. But look, I'm hoping that we get the opportunity to continue this conversation, especially on a day like this. Douglas Chunifor is a specialist dietitian. He's the deputy head of care at Diabetes UK, and we've most certainly benefited from his insights today. Thank you so much for taking the time.